and welcome. I have with me Dr. Patel here today, who's co-founder Sangath, which is dedicated to research in child development, adolescent and mental health. And he's professor of global health at the Harvard Medical School, one of the world's premier psychiatrists and mental health experts, and a really inspiring speaker as well. It's such a pleasure to have you with us today, Dr. Patel. I really want to start right away by asking you, what are the first steps India needs to take to move towards a more comprehensive mental health care system, especially since about 90% of those who are mentally ill in India don't really get any kind of treatment?
So, I want to say, Kaveri, that the first steps have already been taken, and those steps were the formulation of India's National Mental Health Policy and the subsequent Mental Health Care Act, which is fascinating because it is the only rights-based legislation in the healthcare sector in India. So if you pause and think that it is only for mental health problems that there is a law that enshrines the right for people to receive care that is financed by the state close to their homes, it is a remarkable achievement already. I think the real challenge now is how do you operationalize the principles of the policy and the law into everyday practice?
What are the most significant challenges to a comprehensive mental health care system in India?
I think the most significant challenge is really figuring out how we can coordinated mental health care system in which the bulk of care is provided in the community, often in people's own homes, by appropriately trained, supported, and supervised frontline workers, but that this is proper coordination with more specialized services because, no one size fits all. And so it is absolutely the case there will be some individuals with very complex or enduring needs who do need more specialized care, and they should be able to navigate the healthcare system in a seamless way. To me, this is the real big challenge. And let me say, this is not only for mental health, but it is for all chronic non-communicable diseases, whether it's diabetes or heart disease or mental illness. It's exactly the same story.
Do we need specialist interventions according to region, culture, change in demography? Does it need to change? As you said, one size doesn't fit all. Do we need to change that?
Yeah, definitely. I do think we need to adapt interventions to fit different contexts. I wouldn't say necessarily that is for specialist interventions. I'd say the way it's organizing all our mental health care. But one particular area that you mentioned that I think is very specialized is to do with the demographic needs.
Yeah.
So it's absolutely the case that the needs of children, the needs of adolescents, and the needs of older people have often been subsumed under our conversations on mental health, like as if all of these groups have the same needs as adults. And I think that is something we need to address. The needs of children in our country are almost completely neglected. And so, for example, with COVID, the closing of schools is a really wonderful example of how we have essentially taken a dramatic decision that has profoundly affected the lives and well-being of children without even thinking about what impact it has on them.
Right. I mean, schools have absolutely, very few schools have an outreach policy, even now, even so many months after COVID, to actually deal with, say, the class 12 kids who passed out and maybe have, been forced to endure a gap year. It's only now that they've started to realize that they actually need to reach out to these kids and tailor some sort of program for them because they're completely abandoned.
Absolutely. And just as much as there is growing concern that many women in the COVID-19 lockdown period have been trapped in their homes with violent partners, so are many kids.
Exactly.
And I think the fact that we have a completely porous child welfare system, I want to stress again this point. Most mental health problems have their origins in early life. What we finally see in adulthood is usually the interaction of adversities that you faced in early life with our current socioeconomic circumstances. But we focus only on the current stressors and we forget that prevention begins much earlier in life. And I think this is where we must really emphasize a lot of our actions if we genuinely want to prevent mental health problems from occurring.
So do you feel that the government is in a position where it takes mental health seriously? Because when you look at the numbers and you look at the decline in the allocations, it doesn't seem so. Yet the act is so progressive. So the signals are contradictory.
It is, I'll tell you one reason why, because actually money incredibly is being returned by some states to the
Yes.
to the government. And that is even the little money that is being given is not being fully spent in the right way. And I think this is because of the limited capacity of the state level healthcare systems to absorb money because they actually don't have the technical strength and capacity to actually use that money in the way the policy and the act requires them to. And so this is where a lot of my work is really focused on now, is actually how to build technical and human resource capacity so that not only is the current money being spent, but states can actually demand more money. Because to be honest, the finance ministry is not going to release more money when even the existing money is not being fully spent.
Yeah, which is, I think, as paltry as 40 crore. Can you imagine a country as vast as India not being able to even utilize that amount?
Exactly. And as I said, it's not because there's no need, it's because there is no knowledge on how that money should be used. And for example, I'll give you one good example. In many, many states, the majority, I would say, in spite of the community-based focus of the policy and the act, still almost all the money is spent through departments of psychiatry in medical colleges. So there is still a huge disjunction between what the central government has actually recommended and how states are actually implementing those policies.
Is this something where the private sector and the not-for-profit sector can jump in and help, and organizations such as yours, which have actually created a framework, can amplify this?
Absolutely, and this has happened in many other areas of health. I mean, maternal and child health
Yes.
today in India is a good example of that. So I think collaboration between sectors is central to achieving universal health coverage in our country. Obviously, the engagement of these different sectors must be on the same principles, which is that there is a complete protection of people from irrational care, from catastrophic health expenditure, and there's a real emphasis on equity and quality. So as long as those fundamental principles are applied across all health sectors, public, private, and non-governmental, I think together we can do a lot more than what we're being able to achieve right now.
Are there any cases of best practices that you'd like to highlight for us where you've seen the government, non-profit, and the private sector coming together and creating an environment where these issues are taken seriously?
Yeah, absolutely. One example would be in Kerala, where NGOs, panchayat institutions, government and the private sector are working very well together. For example, there are NGOs like the Banyan and others that have models of care which are now being supported by the state government and being delivered within a collaborative framework with the public agencies. There are also similarly smaller examples in other states. For example, Sangath's own work with the government of Madhya Pradesh, which is now 10 years old, has been incrementally building the collaboration. For example, work we did in Madhya Pradesh in only one district has now been scaled up to all the districts of the state. But obviously, because resources are scarce, not to the extent of coverage that we would like to see, but at least it's a tremendous start. So the Mankaksh is what it's called, a center in every district hospital where there are trained counselors who are providing mental health care within a general healthcare setting, is an example of that kind of impact. So there are models. I think we can demonstrate that these work. Another good example is, the Center for Mental Health Law and Policy, which is working in the government of Gujarat through reforming the 4 mental hospitals in that state. So actually, yeah, once you start looking close
Yeah,
to the ground, there's actually a lot of great
right.
examples around.
What are the opportunities you think for investment in this area for corporates who are looking at it closely?
So I would say the 3 or 4 actions that I've been involved a lot with, not just generating knowledge, but also trying to synthesize that and trying to understand what are the actions that we need to translate that knowledge. So there's 2 or 3 things that I think are really important for me anyway. The first is that we need to be focusing on prevention by creating nurturing environments for children and adolescents in particularly their homes through early child development and in schools through promoting healthy school environments. And a lot of my work has been around that. The second, I believe that there is no place for violence and coercion in mental health care, which unfortunately continues in the most extreme forms through, the kind of chaining practices and, forced hospitalization and beatings and so on that happen in some of our institutions. We must make absolutely certain that of zero tolerance of any form of coercion and violence in mental health care, because that's a rights-based perspective. And, we can do it, we can achieve it, and there are already good examples in the country how that's been done. And the third is the scaling up of psychosocial interventions for delivery by frontline workers, the ASHAs, for example, using digital platforms. Three very concrete things, very specific strategies that we know are evidence-based. And if there are corporates who want to be interested and involved in these activities, they can take a pick from one or more of them. But finally, I want to say we have to conceptually go beyond a narrow biomedical focus of doctors, drugs, and diagnoses and embrace the diversity of experiences of mental health and indeed strategies to prevent and promote recovery.
So how does India get to measure its progress in this area?
Well, there are some very good indicators, that the World Health Organization's Mental Health Action Plan has advocated. So I don't want to, do a laundry list of them all. But there are some headline indicators that I think are really important, including, for example, the coverage of known interventions, of effective interventions, interventions that the national policy already embraces, how many people in our community are actually able to access these interventions from prevention to recovery with adequate quality. To me, that's a very important metric of the impact our mental health care system is actually having.
Wonderful. Thank you so much, Dr. Patel. It's really been an eye-opener.